Welcome and thanks for joining us on the Flourishing Life podcast, where we will be discussing what we see on the daily. We're Jackie and Tad from Flourish Medical and Wellness in Savage, Minnesota, where listening to our patients is the priority. Our foundational medicine clinic bridges the gap between traditional and functional medicine. We are pattern recognition specialists that focus on individualized patient care and health optimization. With a combined 30 years of medical experience, our goal is to provide insights that will help you take control of your health. Be sure to follow us on Instagram at Flourish Medical Wellness and on our website, flourishmedicalwellness.com, to stay up to date with what's happening at the clinic. The following content is the opinion of Jackie and Tad Tewes and is not intended to diagnose or treat any medical conditions. Please be sure to speak to your healthcare provider for your unique needs. Hey everyone, welcome back to the Flourishing Life podcast. Tad and Jackie here from Flourish Medical and Wellness, where our priority is listening to you, our patients, and practicing a team approach to foundational wellness for long-term healing. Today we are here to dive into another myth. Coming up in September is Healthy Aging Month, and so we're going to spend some time talking about aging and the process of aging on the body and some of the things that we hear around this and that our patients are told. So here we go. Some of the things that patients tell me when I'm chatting with them is that maybe they visited a provider already and kind of had some of these concerns, and they're just told, oh, you're having these symptoms because you're getting older. Or a lot of times women will tell me that their provider said, oh, you're just not sleeping because you have kids. Do you hear anything like that on the guy side?
Yeah, one thing that we hear pretty regularly is that brain fog is normal or cognitive decline is normal as we age. Also that energy should go down as we age, and we just shouldn't have the energy that we did 10 years ago, and that's completely normal.
Yeah, so it's important to understand that, yes, as we age, things are going to change, right? Like our hormones are going to change. They're going to decline over time. One of the really important things that I think we need to touch on is explaining how we're seeing that happen more and more prematurely. So instead of having kind of this aging decline with our hormones in our 50s and 60s, we're seeing it sometimes even in our 20-year-olds. And that's a big problem because not only are we feeling terrible and have a worse quality of life, but I think the even bigger issue there is that the reliance of our organs on hormones to function appropriately and properly is huge. And so now when we live, if we're seeing that decline starting in our 20s and 30s, and we're living till 80 with minimal to no hormone support for our organs, that's a big deal in overall longevity and overall health span, not just lifespan. So we'll kind of dive into that a little bit today. I would say the biggest thing that we see as part of that reason for disruptors and why we're seeing that premature decline is going to be EDCs, or endocrine disrupting chemicals. And this really can impact those hormone levels. Specifically, the increase in phthalates that we see, this actually is associated with a 10 to 24% decrease in testosterone levels. And it can also move menopause up by average about 2 to 4 years. So that's a big deal. And so it's important that we understand not only what are those things, but how are they impacting our hormones, and then how does that impact our overall health?
Yeah, and the natural trend is for hormone production to go down over time in both men and women. And it's a little bit different timing, as you know. When we look at perimenopause and menopause for women, we'll see that relatively drastic decrease in estrogen and progesterone production, whereas in men, we refer to what's called andropause, or loss of androgen production. And we see that a lot in guys' 30s is typically when we'll see the most significant drop on the front end. But if guys are taking care of themselves, maybe that occurs in later 30s, sometimes even in their 40s, just depending on lifestyle, diet, how much sleep they're getting, the amount of stress they have, as well as habits like alcohol intake too. So there's a lot of pieces to it. When we look at changes in hormones in both men and women over time, there are those normal physiologic trends, but then there's other pieces to it, like how well are those hormones actually binding to receptors when they get to their target cell? And as you know, when we make hormones, we have specific glands that are secreting or making these substances, putting them into the bloodstream so they can circulate through our whole body, get to all those different organ systems so they can ideally attach to that receptor for that organ system and make the desired effect happen. Now, a lot of that requires the ability of that hormone to actually get into a cell, bind to that receptor, and there's a lot of different pieces as we age that can slow that process down or even make those receptors less sensitive. Like you had said, a big piece to that can also be toxins. So things that we're exposed to in our environment, whether it's phthalates, whether it's pesticides, whether it's mold, heavy metals. Mold and heavy metals are two big ones that fortunately now we test for a lot more because we know how profound those effects can be on people's physiologic function. But that's where, even if there are relatively normal or even optimal levels of a hormone circulating, if we have those toxins interfering with the binding to the receptor itself, or the expression then of what happens after that hormone binds to a receptor, they can block those pathways, and that can cause significant symptoms or lack of improvement in certain areas.
And so I think too, we try to live healthy and, like you mentioned, get good sleep, take care of your bodies, exercise, eat well. But if you're having those exposures inadvertently, or you're not aware of that, that can be wreaking havoc on your hormonal system, and you're not even aware of that.
Absolutely. And where we see that is in those people who come in who have not changed their lifestyle at all. Typically it's people, and these people too, they come in, they live a very healthy, diligent, intentional lifestyle, and then all of a sudden something changed over the last year or two. And they say, okay, I was doing this exact same thing in 2024, but now I don't have energy, I'm waking up with headaches, I have more brain fog, what's going on? And that's where looking at, potential exposures, and then mold's a big one, as you know. All right, so let's talk about what hormones are. So hormones have hundreds of functions in the body, and they do all kinds of things for us, from body composition to how we think, our memory, to prevention of chronic disease, how we digest food, how our heart functions. All of that is impacted by hormones, but they're chemicals that are made by the body. They act as messengers, they bind to their receptors in all those different organ systems, and when they do that, they are supporting normal physiologic function, or that normal function that we all should have. An example of that is insulin. Everybody needs insulin. It controls our blood sugars. And with hormones, oftentimes too much of a good thing is not a good thing. And we see that with sex hormones like testosterone and estrogen, but we also see that with hormones that control blood sugar like insulin. If a diabetic gets the right amount of insulin, it helps control blood sugars. Too much insulin, and it's going to kill them. So all in all, it's hard to quantify, and it's hard to identify all the different things that hormones do in our body, whether it's our digestive hormones, thyroid hormones, sex hormones, but they really control every metabolic process that we do and how we function normally. And that's why loss of hormones, especially later in life, is so profound. And with people living longer, like you said, there's this longer period of suboptimal function in the body not being supported.
Which is then where we see things like higher likelihood of insulin resistance or diabetes, or even high blood pressure, high cholesterol, those types of things.
Absolutely. And dementia is another big one.
So one of the things I often hear from the female patients that I see is that they are told that testosterone is a male hormone. Do you ever hear that?
All the time.
All the time. It's very, very hard for women to get their testosterone levels checked, right? Like, it's never something that's just, oh yeah, let's check your testosterone. It's something that if you want checked, you really have to fight for and ask your provider. And I would really encourage you to do that, because it is such an important hormone for us. So women actually make more testosterone than estrogen. So some would argue it's a more important hormone for us. Obviously, it doesn't help us in the childbearing situation. So estrogen's and progesterone's very important for that. But we make more of it. And so it is a very important hormone for us. In our 20s and 30s, we actually make 50 times more testosterone than we do estrogen. So it's so, so important. It protects every organ in our body. It is known by some as kind of the source of life and vitality, of youth and vitality, because of how it acts on things like our body composition, our motivation, our moods, our memory, all of those things. I'll never forget, I had a patient once, this was probably 3 years ago, that she came to me after we kind of set up a treatment plan for her and got her on some bioidentical testosterone. And she sent me a message because she was terrified because her provider told her that her testosterone would cause her to grow a penis.
Mm.
Like legit, that is what she was told. I don't even know what to say about that. Like that's not how that works, right? Like you are made with testosterone as women. We're made with testosterone.
Yeah.
If you pump me full of testosterone, that doesn't mean I'm gonna grow a penis all of a sudden. That doesn't work that way.
And unfortunately, it's a lack of hormone education. And a lot of this has stemmed off of the WHI effects from the early 2000s, where providers have really shied away from hormones unless they're in a specific realm of medicine where they have to become educated on that. And so it's unfortunate because, like you said, when we look at quality of life and then long-term with disease prevention, testosterone is a big part of that for women, not just a male hormone. If you put a woman, let's say, on a medication that will block androgens, or if you have a woman living a lifestyle that really suppresses androgen production, like high-level opioid use, alcoholism, usually that woman is just not going to feel and function well. Really poor outcomes there. And actually, there's some nice studies that support that too.
And a really common one for that is going to be birth control. Oral birth control isn't necessarily directly blocking testosterone, but it's creating a whole bunch of SHBG, which then inadvertently blocks a lot of that individual's testosterone.
Yeah.
And women think, I hear this a lot too. I felt terrible being on birth control. And that's why, like, we're blocking the body from being able to use so much of its testosterone, which is so important, especially in our younger years.
Yeah.
So for me personally, this was, I think, when I had my testosterone levels checked, probably 4 years ago now, 4 to 5 years ago. It was at the level of about a 60-year-old. So in my 30s and about a 60-year-old, which was having significant impacts on just my daily function. So my word finding, that's a big one for me. My joint pain, inflammation, moods, motivation, energy, all of those things. So I personally can speak to the importance of testosterone in women, even though it's not something that was ever checked for me. I had to kind of go out and educate myself and learn about that and then advocate for myself in that way. So again, women have testosterone. We make more than estrogen. It's really, really important to understand that. As Tad mentioned, he kind of said, andropause is that decline in our androgens or testosterone for the most part. We did a full podcast on menopause and perimenopause, so that's also part of women and aging and healthy aging. So go back and listen to that if you didn't catch that one. In women specifically, testosterone is going to be our first hormone that starts to decline, usually somewhere in our 20s for most women. And then we're going to lose about 50% of our testosterone production between the ages of 20 and 40. So that's a pretty significant drop. And then if we're starting at a lower level to begin with, because of some of these EDCs or endocrine disruptors in our natural environments, then we're dropping even lower, even quicker, and we're going to be more symptomatic. So testosterone is first, then progesterone is what we tend to see decline next, usually starting in our 40s. The reason for that is, remember that progesterone is made from that corpus luteum of an egg. So if we're not releasing an egg, we're not getting progesterone. And then kind of what I tell women, the grand finale is that estrogen, right? That's our last hormone that will eventually stop being produced. Varies. The average age here is about 51, 52 for that to happen. But you're going to see kind of these changes and these steady declines. First testosterone, second progesterone, final would be estrogen. And each one comes with a little bit different symptoms. And so you can feel, perimenopause and menopause is kind of this big hot topic right now. And you can feel some of these changes when it's not even estrogen or progesterone related. It could be testosterone related, especially if we're in our 20s and 30s and we're starting to feel some of those symptoms.
Yeah, and where we hear that in clinic is, I'm starting to slow down. I'm feeling my age. When women say that in the 30s and 40s, typically that's going to be during that period of testosterone decline. And then when we start seeing progesterone, we can see some changes in terms of energy, mood, sleep. Progesterone is a great hormone when it comes to sleep for women. And then obviously more of the classic perimenopause, menopause symptoms when estrogen goes down in the late 40s, early 50s.
Yeah. So let's talk about that a little bit, kind of the ones specifically that we look for with testosterone, progesterone, and estrogen. I think another big one that I see is a lot of women, especially after having kids, right, in that postpartum time, will really start to see a change in their overall health.
Yeah.
And as you mentioned, stress is a huge disruptor for testosterone, right? And so when all of a sudden we go from, living kind of this easy life that we can have our own schedule and do our own things, and then not only does our body go through pregnancy and having a baby, and now we're responsible for another human, a lot of times we can see a big dip in that testosterone, which is going to impact sleep, moods, motivation for sure, libido. It can impact muscle mass, brain fog, obviously workouts. I would say those are kind of the big symptoms for testosterone. Anything you would add there?
Yeah, one big piece with testosterone also is the insulin sensitivity piece, or the ability to manage blood sugars efficiently. And we see that in a fair number of women postpartum and even months or a year postpartum where that insulin sensitivity has changed. We're seeing average blood sugars start to rise, typically on that hemoglobin A1C on the lab work. But that is a big piece to it, especially for long-term health.
Yeah. And then progesterone, which is that next one, you kind of mentioned these. The biggest ones we're going to see are, again, sleep, running warmer at night. Also, they're just running warm, maybe some night sweats, but just feeling more warm in general at night. Severe or more intense PMS symptoms, so more moody, especially that kind of luteal phase, so leading right up to that period. And then changes in periods. So maybe they're having some spotting in the month, maybe their periods are a little bit shorter. And so when you're seeing sleep, running warm at night, more moody, and period changes, that is almost always a progesterone issue.
Yeah, and progesterone, when it's secreted for women at the right levels, it should be a calming hormone. It tends to have that calming effect or evening out of the mood effect.
Yeah. The other thing that we can see around that time is really weight gain, specifically in the hip and thigh region, can have a direct correlation to changing progesterone levels as well. And then that final one, which I think gets a lot of attention right now, is estrogen, obviously. And it's also super important. Estrogens are lubricating hormones. So yes, vaginal dryness, it's going to lubricate our joints as well. So we think about things like frozen shoulder or joint stiffness. That's a big one. Again, moods, depression, anxiety are so common when that estrogen falls. And then I see this pretty much every week where estrogen levels drop and the LDL bumped up, the HDL went down. There's a pretty strong correlation that I see clinically there, and we see it in the research too. But estrogen is so important for our heart, so we'll start to see some of those things change. It's also really important for bone density. I think you'll touch on that a little bit as well, but we need both estrogen and testosterone for that, and I'll let you dive into that a little bit later. And then we also see increased just overall cancer risk, including colon cancer and things like Alzheimer's and dementia as estrogen declines also. Anything I missed there for estrogen?
Well, that was really good. And the big piece just circles back to all of those hormones being general health supporters or messengers that are put into the bloodstream. They have effects on all of our organ systems. And when we start to lose that support, that's when we can see that increase in chronic disease, whether it be cancer, heart disease, dementia, osteoporosis. All of those have strong ties to hormones.
Yeah.
But andropause is the flip side of that, and that's where, for men, we start to see testosterone dropping, usually sometime in the mid to early 30s for most men. That can be drastically affected by lifestyle, though. Genetics can also play a role in that, but things like high stress environment, poor sleep, sedentary lifestyle, alcohol and drug use, all of those can suppress testosterone production significantly, even in a guy's 20s, when that testosterone should be at a more optimal level. And when we think about the effects of testosterone for men, it is our get up and go hormone. It is energy producing, being a motivating hormone in terms of ambition. I hear this when talking with men from the professional world where they say, wow, getting my testosterone to an optimal level, it made me so much more motivated. Or, wow, this just helped me cap off my best year of sales that I've ever had. And it's those types of things that we see testosterone provide consistently for men. It also does for women too. I shouldn't say this like it's just men, but for women as well, it does provide some of that ambition side to things, especially if a woman gets into her 30s and 40s and feels like, hey, I'm just drag compared to where it was 5 to 10 years ago. And then when we look at things like physical performance and recovery, this applies to both men and women, strong anti-inflammatory effects with testosterone. So we see that in terms of joint health. Recovery from exercise is a big one. A lot of people come into our clinic saying, yeah, I would like to work out, but it takes me 3 to 4 days to recover, so I can only do it twice a week because I'm so sore. Well, when we start putting some of those anti-inflammatories back in, mainly testosterone, we can see workouts become more regularly and more enjoyable, and it just becomes a healthier lifestyle over time. And then what I like even more from the anti-inflammatory perspective is the effects on risk for heart disease. You know, if we think about the insides of our blood vessels, what we're finding, especially in newer research over the past 10 to 15 years, is inflammation to that endothelium or the inner lining of blood vessels is a huge risk factor and a huge component for developing clots or developing heart disease. Well, if we can decrease the inflammation there and even make the vessels slightly larger through the vasodilatory effect of testosterone, that can really help on the flip side with regard to heart disease, as long as it's at optimal levels. Finally, I'll talk about one or two more here, but dementia is a big one. And when we look at both estrogen and testosterone, depletion of those hormones can lead to significant cognitive decline, especially later in age. And a big part of that, too, is women especially are living for longer. So when you are living for longer as a woman and you're running on empty or very low levels of these hormones, eventually cognitive decline becomes a significant risk. And that's where women in their 70s and 80s, loss of testosterone, loss of estrogen for those prolonged periods can lead to the increased risk of dementia, especially Alzheimer's, and then also osteoporosis and loss of bone density as well. So there's a lot of pieces to this, and I think we're starting to paint the picture a little bit more about how these helper chemicals, our hormones, are so important for everywhere in the body. And if we have long periods of time when we're depleted of these, they can lead to some pretty significant disease states.
Yeah. So that kind of is a nice segue into, so what are our options, right? What are our options when it comes to healthy aging, longevity? How do we prevent these disease states from occurring? You know, what are our options for that? And so let's dive in a little bit to different types of hormone therapy options, hormone replacement therapy. I will often, I think I just had this question last week, get questions about, you know, there's supplements out there for hormone therapy too, or to help with, you know, aging and osteoporosis and andropause and menopause and all those things, which totally fine. You know, sometimes I do have women who do well on those symptomatically. It's really helping with symptoms, but no matter how much you supplement to help with your symptoms, you're not putting back in the hormone that your receptors are needing.
Yeah.
So there's a big difference there. And you have to remember that, like, yes, we can control symptoms. We can even, you know, get through menopause and andropause even a little bit better with some lifestyle changes, but we still have a deficiency at the receptor level, which long-term will impact organ function and organ systems overall. So it's really important to understand that. I hear frequently that testosterone therapy is not safe for women. This kind of goes back to what I was talking about initially and just the lack of understanding that, yeah, we're made with testosterone, even more than estrogen, and we need it. But this is a pretty common thing, especially because the safety has not been established when we look at the FDA, because there is no current FDA-approved testosterone therapy for women. I think this is something on the horizon, hopefully, where they're starting to pay more attention to this, but currently there is not. However, this idea that the safety has not been established is a false statement. Okay, so testosterone therapy in women has been used for 86 years. Okay, 86, that's a lot of time to establish safety or non-safety or harm of this. So this dates back all the way to 1939. Interesting fact here is that testosterone has never been banned or removed by the FDA. So if we think about that and the number of things that, we jump on this bandwagon and all of a sudden it's really good, and then, oh wait, hold on, that wasn't so good. We actually are removing this from the market. That happens so frequently with different types of medications and FDA approval. It's never happened with testosterone. So I think that speaks volumes to the importance of it. It was actually included in the World Health Organization's 21st edition list of essential medicines. So I think that's important to call out as well. And then the other really, I think, piece that speaks volumes to testosterone therapy is that 95% of users who are on it remain on it, right? So we're not going to remain on something if it doesn't help us, if we don't feel better, if we don't see improvements in our overall health. And so it works. It's a very effective therapy to not only help you feel better, but to also support longevity and overall health and vitality.
Well, and to piggyback on that, it's not FDA approved in the United States. In other parts of the world, there are approved treatment options for women for testosterone. And so it's not that this is a global situation. This is more of the United States situation. And being on more of the leading edge of this, we certainly see a little bit more resistance or more questions to that. But just based on the science, within the next 10 years, there should be numerous FDA-approved testosterone options for women. And that should be coming down the pipe if we simply follow physiology for women and the role of testosterone, especially in middle of life and later in life too, for disease prevention.
Yeah. So I'm going to dive into hormone replacement therapy options for women, and then you can chat a little bit about those for men as well. They vary a little bit, but so let's kind of separate those out. So we've talked about this in a previous podcast, maybe a couple of them, about the difference between synthetic and bioidentical hormones. So we really are strong advocates, I think you would agree with this, to bioidentical hormones, meaning that molecular structure is identical to what your body makes, so that your body recognizes it, it uses it, it fits perfectly into the receptor site, and we see much fewer reactions or side effects happening because it is an identical molecule. When we start getting into the synthetic molecules, they're not identical. They do have a little different structure. And so that binding to the receptor can cause different domino effects and side effects or different adverse reactions. And so we really stay away from those. Like, it's just not worth the risk, in my opinion. I think you probably agree with that as well.
Absolutely. Yeah. And when we look at hormones, it has become commonplace to use some synthetic hormones in both women and men. We see that very commonly in birth control for women, but it doesn't necessarily mean that it's going to be the best option, because it's not putting something back in the body that was normally there. It's putting in a novel substance the body hasn't seen before.
Yes, which I always think is funny too, when you get that pushback from a patient comes in, they saw their provider and they're being told not to use bioidentical hormones, but they're more than willing to give them a birth control, which is a synthetic hormone, which we know orally can impact clotting pathways. Like, it doesn't make sense, right? It's just a lack of education and understanding around how hormones work and how they're created. So there are different ways to get those hormones in. Creams are a very common one. We use those here. There are some studies that show we can't always reach that therapeutic level when we talk about disease prevention and longevity, especially with bone health. So that one can be a little bit tricky. So think, creams we're applying, it has to go through the skin barrier. And so I've had this, some women absorb well, and some women are not great absorbers from the skin, and their levels just don't come up. And they don't come up enough for a therapeutic response, especially at that organ and tissue level. So that's something that's really important to know. Am I a good absorber? Am I not? Something that we take into consideration when we're making recommendations for that individual. And then we have patches, specifically estrogen patches. There was a study where Dr. Anderson found that women using estrogen patches actually lost bone density compared to a subcutaneous option like a pellet. So that's something to be aware of as well. Again, I see several patients who are like, hey, I just want to work on getting my bone density up. And it works. Hormones work for that. So we have to know kind of what are our long-term goals when we're using this. And that has to be a part of our decision-making as well. Pellets, so those are going to be subcutaneously implanted, little, kind of like a grain of rice that just completely dissolves over time. For women, they last for about 4 months. I would say most on average. Men closer to that 5 to 6 months. And this, a lot of people ask me if pellets are new, like if this is something that's newer, and they're not. Again, these date back all the way to the 1930s. And one of the cool things I think about this was Dr. Rebecca Blazer's work around pellet therapy and breast cancer. So she is an oncologist who tried some experiments with her patients who were up for that. And what she did was she implanted those testosterone pellets around breast cancer tumors and found that it actually shrunk those tumors, which was amazing. So testosterone is anti-neoplastic, so it helps prevent neoplasm or tumor growth. But her incidental findings were that these women felt amazing, right? So the women that she had on chemo versus these women on testosterone pellets around the tumor, like they were sleeping well, their relationships were better, they had more energy, they were more active, like they just felt better overall. And that's where she really started giving a hard look at, oh, there's something to this testosterone for women.
With Dr. Glaser too, I mean, she's done incredible studies, which are typically cancer-based because she's an oncologist, but when she also fleshes out the impact of quality of life, especially in segments like women going through chemotherapy, it's pretty impactful. Because typically when you're talking about radiation or radiation with chemotherapy, there's a really poor quality of life in that group of women going through that type of treatment.
I will sometimes hear this pushback that pellets are more difficult to control in the dosing and the absorption and the levels. Just personally from clinical experience, I haven't found that, and I'm curious to what you think as well in your experience, but I actually find it a little bit more difficult to control creams and the absorption levels, whereas I think, I've worked with pellet therapy for so long and so many people that it's pretty easy. I think it's actually easier and more simple for sure because they don't have to be dealing with this every day, and there's less of those ups and downs every single day with their hormone levels. What has your experience been?
Yeah, I think we'd have to define controllability and understanding different delivery mechanisms. Now, if we're looking at a topical cream that has to be applied daily, at time of application, you're not going to get any transdermal absorption immediately. You're going to get that over the first hour to 2 hours, and then you'll typically have a peak period of time. Now, where that blood level is at on peak is totally dependent upon that person's transdermal absorption through the skin. And that variation, think of it as a membrane, and that membrane is totally different for certain people as compared to others. We've both looked at this, and if we had 10 women of the exact same body size line up, and we gave them the same amount of estradiol cream, and we blood checked in 3 hours, you're going to see changes that are completely different. It's all over the map, depending on that absorption of that individual. And so, even with that absorption variability, you're going to have this short period, usually somewhere between 4 and 8 hours, where they're up at that peak level of what it would be for that amount of medication, and then it drops off again. And so you have this short period of optimal levels, and that's why you don't see the long-term disease prevention. That's why you won't see the improvement in bone density, is because it's such a short period of time at an actual therapeutic level. So if we're looking at controllability, topicals tend to be some of the worst in terms of true periods of time where they're at an optimal level for physiologic function.
Yeah. And then we have oral, obviously, oral testosterone, oral estrogen, and injections. And we don't really use any of those here. The reason for that, number one, they're synthetic. Number two, you can get some bioidentical oral testosterone and estradiol, but we know that oral estradiol affects the clotting pathways and increases clotting risk. So that is an absolute no-go for us. And I would recommend that for any of you considering oral estrogen. It's just not a safe option when you have safer options available. And then oral testosterone has kind of been just thrown out a little bit. There's a newer one, which we also touched on in a previous episode, but kind of your traditional synthetic testosterone, which is bypassed by the liver, really cause some significant liver issues. And so that's really not used either. And then again, all injections that I'm aware of for testosterone are synthetic, meaning they are not bioidentical. And so it is my personal preference that I don't use those for patients because they're not as safe.
Yeah, and to speak on oral testosterone, like you had said, in the past, liver toxicity was a problem. Some of the newer oral testosterones, we're still waiting on long-term data for those. Because of their involvement with that lymphatic system, we're in wait and see mode. And I think that's the prudent thing to do, is make sure that we don't start people on these medications and then 5 years down the line you see significant problems or increased, long-term health complications.
For sure, absolutely. And then the last piece is just synthetic progesterone. And so we only use bioidentical progesterone or micronized progesterone here with our patients. There is a synthetic progestin. And you need to understand that this was actually been shown to undo the protective effects of estrogen, specifically on the brain, on the heart, and your cholesterol. So again, it's really not something I recommend people use. And we know that bioidentical progesterone, or the micronized progesterone, actually increases blood flow to the heart. So again, our hormones, we were created with hormones for a reason, for a specific purpose, to do really good things in our body. And now we're in this world of kind of having this premature decline in our hormones, literally because of the air we breathe, the water we drink, the substances we put in our body, the chronic stress, the poor sleep. And if we're living without these hormones, without adequate levels, our longevity and our disease, it just increases significantly over time.
It is. It's the equivalent to now we're all kind of living in a toxic soup.
Yeah.
And that also speaks to binders too, which we've talked about. Everybody should be on a binder just to help get rid of what we're exposed to on a daily basis.
So tell us a little bit about different ways to put hormones back in for males specifically.
Yeah. Well, first off, when we talk about hormones for men, sex hormones for men, it's just testosterone. We're not giving guys estrogen. Now, we'll make a little bit of estrogen ourselves and then convert some testosterone to estrogen. And we do need small amounts of that in males, but definitely not something that we would purposefully give to men. So for testosterone, let's start actually with injections, because they're relatively common in terms of use, with a synthetic testosterone called testosterone cypionate being the most common form. Now, most of the time, this is dosed by providers once a week, sometimes even once every 2 weeks. But to get relatively even blood levels, it should be at least twice weekly, just so we don't see, if it's a weekly administration of testosterone cypionate with an injection into the muscle, what you're going to see is that level climb from injection day to day 1, up on peak from probably day 1 through day 4, maybe day 4.5, and then start to fade off toward the end. And so you don't really get consistent blood levels. Those guys will be good for about maybe 50 to 65% of the week, but otherwise they're not at that therapeutic window. Some of the downsides with synthetic testosterones that are injected are going to be, they're typically going to be put in the seed oil, which is inflammatory. That can lead to swelling, pain at the injection site, definitely leads to inflammation there locally because of the seed oil. And then with their synthetic nature, we can see effects on blood clotting specifically. So there's a substance in clotting called thromboxane A2. And the name doesn't mean anything, but it's involved in how we clot and how our platelets stick together and clump. And if we increase the activity of that thromboxane A2, we can see more platelet clumping. Over time, if we see that increase enough, it increases a male's blood clotting risk. And that's obviously a significant risk. The other piece that I really don't like, that I see probably 80% of the guys who come into our clinic, who I see who come in on an injectable testosterone, come in with higher than normal red blood cell levels, or what's called erythrocytosis. What that means is that repetitive injection twice a week or once a week, it's stimulating the bone marrow to increase red blood cell production, to the point where eventually that blood thickens, and it also increases their risk for blood clotting. So that's something very common with synthetic injections, and something that we really try to avoid by not having those constant peaks and troughs, the going up and down of that testosterone level. Creams are also somewhat common. Topical testosterone cream for most guys is just super inconvenient. I mean, guys may try a cream for a month or two and say, all right, this is miserable. I don't want to do this. I got to apply every day. I got to be really careful about washing my hands, making sure I'm not getting this cream on the faucet, on anything that could come in contact with children or with my spouse. I have to make sure that area is completely dry and that doesn't come in contact with anyone. And then you have the short peak period with topicals as well. Other forms, oral testosterone, like we had talked about, there's some newer ones that are broken down in the lymphatics. We'll wait and see on those. That's going to be a little bit longer term timeline. And then bioidentical pellets, or pellets that are placed under the skin and what's called the subcutaneous tissue. One of the reasons that we opt for those is, number one, the delivery method is that slow release of a bioidentical hormone. So we're not giving a novel compound, we're just putting back in what was once there in higher amounts to get that body to an optimal level. I find that from a blood level and stability standpoint, pellets are going to be our best option. And part of that too is how we do pellets. We make sure to check blood levels at appropriate intervals so we know what does this dose do for this man and how long does this last with how his body breaks down pellets. And we can get a very personalized protocol in place, and that's what yields to just that improvement in quality of life and the long-term disease prevention. The other piece, when we look at the analytics of how to deliver the right hormone the right way, it's just one piece of the puzzle. Getting that done right, then you have to weave that into that guy's lifestyle. And that's where all the other pieces come into play too. And the nice part is testosterone for women and men can support those good lifestyle habits and make those easier too.
Yeah, and to piggyback on that, this is something we learned over time, and I would kind of caution guys out there who are looking into hormone replacement therapy. If you are only getting hormone levels, there's a much bigger picture, right? And this is something that we learned. You cannot out-hormone a bad lifestyle. You can't out-hormone other things happening in the body. Like, you have to make sure that the whole system is functioning well. So you really need to make sure that if this is a road you're going to go down, what's happening with your detox pathways? What's happening with your gut? What's happening with, again, those lifestyle pieces? It's the full picture. It's not just hormones. And I do, like you mentioned earlier, too much of a good thing isn't always a good thing. And there are times, and we've seen this too, and I think that's where sometimes testosterone replacement or hormone replacement therapy can get a bad rap, because sometimes it's not practiced well. And we can't just be dosing people super high to these really high super physiologic levels, because that's not good for the body either. And so you really, yes, you have to check frequently, you have to know where your levels are, and then you have to look at the whole system together as a whole. And I think when it's done in that way, the impact on people's lives. I mean, you just had a patient this last week who shared with you how it's changed his life.
Yeah. And that's the way it should be, is when it's dosed appropriately, it should yield a healthier lifestyle, increased energy, better mood, better sleep, all those things that we think about going back to our 20s. That's what we're shooting for. It's interesting, we talked about hormones being dosed appropriately, and too much of a good thing isn't always a good thing, and that's a tough conversation to have, especially with men. I get a fair number of guys who come in here on high doses of injections, and they're sent over here because they're starting to have some side effects from that, whether it be a lot of acne, increased red blood cell production, increased conversion to estrogen, and their estrogen is sky high with that testosterone. And being able to communicate that, hey, this is not what your body wants. Yeah, you may feel like Superman for a couple days a week and you're putting on muscle, but your body's overloaded with testosterone, and this is not good long term. This is not sustainable, and something bad's going to happen if you keep going down this road.
For sure, absolutely. And yeah, it's not an easy conversation to have, but it's the right conversation to have.
And these things take time too. If that guy is used to in and out visits where it's like, hey, here's your prescription for testosterone, 5-minute visit, and I'll see you back in 6 months. Just the care provided is not ideal.
Yeah, for sure.
All right, so let's talk about some other things with regard to hormones. Specifically, let's talk about hair. And I don't know, you like talking about hair. I hate talking about hair. It's not my favorite thing. There's a lot of other stuff I'd rather talk about. But testosterone is oftentimes implicated for hair changes or hair loss. And when we look at testosterone specifically, that's going to be that conversion of testosterone to the androgen called DHT, or dihydrotestosterone, which is a very, very potent androgen, and it can have some significant effects on hair follicles in both men and women. So where the rubber hits the road for men and women is if a person naturally is converting testosterone to DHT, simply due to that person's genetics and the way that person's body functions physiologically, you can start to see hair changes, especially hair thinning. In males, we'll see male pattern balding as well.
And so that's the top, right? Kind of that front top area.
Typically, yeah, it's going to be the top, sometimes in the corners. You'll see some changes in those areas with DHT. And that's where there's a specific enzyme that does that called 5-alpha reductase. And there are medications like finasteride, dutasteride that will help block that. Typically, those are going to be prescribed for prostate symptoms, but they can also be used for hair preservation too.
And there are some other natural supplements that you can use as well to help with that, blocking that DHT pathway to make sure we're not getting too much conversion happening there.
Absolutely. And the interesting thing, it's the DHT really that affects hair negatively. Testosterone, though, it's good for hair. It's good for hair growth. It can be good for hair regrowth as well. It's just understanding that we don't want to get that conversion over to DHT. And that's where even things like a topical finasteride that's compounded or a topical dutasteride can be very helpful for people who want to see the benefits of testosterone, but know that their body really actively converts to DHT. Another thing, and this is a common misconception, well, doesn't testosterone cause aggression? In very high doses, absolutely. It will cause aggression and irritability. The guys who come in on high doses of shots like I talked about, they're going to be my scapegoat here, where they are more prone to that because they get a high peak level and then they drop off the cliff when it comes to the end of that injection's therapeutic window. Testosterone, when it is at optimal levels for men and women have a different optimal level for testosterone in the bloodstream, but when they're at an optimal level, testosterone is that calm and confident hormone. It has some very positive effects on mood, on management of stress, and where we see that most of the time is in the professional setting, in men and women, where when that's at an optimal level, more productive, able to multitask better, able to manage stressful work situations better. But certainly, if it's a super physiologic level, or let's say 30, 40, 100% higher than what the body wants it to be, there can be irritability there.
I hear that in moms a lot of times, they're shorter with their kids when their levels are too low, when that testosterone is low.
For sure.
It's this like, I responded too quickly or more quickly than I would like, and I just don't feel like myself in that way, just more short fused, more irritable. That's a really big one when those testosterone levels are low. And then again, if they're super high, then you can kind of start to see some of those things as well.
Yeah. And it's interesting, we've gotten into this habit in this country of looking at sex hormones like estrogen and testosterone different than we look at other hormones, like insulin, like thyroid hormone. But these all play a role in normal physiologic function. They're not special. They're just another piece that we naturally produce. And there are consequences when we're really low. Just like if we're really low on thyroid hormone production, hypothyroidism, low energy, apathetic, gaining weight. You can even have swelling, constipated. So it's not that these hormones are something magical or amazing, but when we return those to normal levels or optimal levels, that's where we should function better. So let's segue over to long-term disease states, because this is something that's near and dear to both of our hearts, is trying to decrease that risk long-term, especially with people living longer. And heart disease is the big one. That's typically the elephant in the room that we say, okay, how can we minimize risk for heart disease? And specifically when we're talking hormones, testosterone plays a big role in this. One piece that is unexpected for most people is its role on insulin sensitivity, or helping insulin to control blood sugars better so we don't move into that insulin resistance, prediabetes, and then diabetes, which can have drastic effects on our propensity to develop heart disease and have narrowing to those arteries that feed the heart. The other piece is testosterone is anti-inflammatory, like you talked about. And where our patients see this most commonly is going to be in their joints, where it's my testosterone's at a good level now. Wow, my knee doesn't hurt anymore. I can actually get back to long walks with my dog, or I'm recovering from workouts much better. But where we both also look at it is that endothelial lining, or that inner lining of the blood vessels, and understanding that anti-inflammatory effect on those areas can potentially prolong someone's life, because they're not seeing that inflammation and then the development of heart disease, which could lead to a heart attack later or even a stroke. And then the other piece is the vasodilator effect, or testosterone mildly increasing the size of blood vessels so that constriction is not as significant, tends to have a mild improvement on things like blood pressure, and that can have some pretty important long-term effects for the heart itself. When we look at the anti-inflammatory nature too, and we look at pain chronically, testosterone's ability to decrease pain, especially with osteoarthritis, is huge. Pain itself will tend to decrease hormone production in both women and men because of the effects of the brain, with the hypothalamus talking to the pituitary gland. It's sending out different chemical messengers, and that's the effects on the adrenals in the body. Now, the adrenals are those little glands on the kidneys. They make cortisol. That's their claim to fame. The problem is, the more pain we have, the more stress it induces on the body, the more cortisol it makes, the more suppression to hormones like testosterone. So there's this feedback loop there that is pretty important when it comes to regulation of those helpful hormones, or those messengers in the body. When it comes to bone density, testosterone and estrogen, they both play a role. And this is much more common in women to see things like osteopenia or then osteoporosis when it becomes more advanced. But that loss with bone density, we're looking at the activity of two different competing cells. So osteoclasts, which break down bone, and then osteoblasts, blast meaning that you're building bone. We want to make sure that as a woman ages, we see that osteoblast activity ideally outpace, or at least keep even with, the osteoclast activity. And that's where especially testosterone will help support that osteoblast activity. And that's why we have studies now that prove estrogen is really a bone maintaining hormone for women especially, and then testosterone is that hormone that can actually increase bone mineral density. When those two are used together in menopause, it can have pretty significant effects on the serial bone density scans. And then lastly, when we're talking about cognitive performance. So cognitive performance, especially for women, is something that is incredibly important, especially with women living longer than men. So women get a little bit of the short end of the stick on this one with the changes that occur in menopause, but also how testosterone drops off sooner than it does for men. So we think about a longer period of time with low testosterone levels, and then having a pretty drastic drop with estrogen through perimenopause and menopause, and then living longer on the back end. So the brain is functioning without those supportive hormones for a very long period of time. And that's a big piece to why we see the increased rates of dementia in women versus men. And the other piece to this with Alzheimer's is, as testosterone production decreases, or as that serum level of testosterone that's in the blood decreases, we'll see increased beta amyloid plaque production and deposition. Now, beta amyloid plaques are what we find in Alzheimer's disease. We find those changes on the brain, specifically when we're doing brain imaging like an MRI. If we increase that testosterone, not only does it help suppress that beta amyloid plaque deposition, but it also upregulates or increases the activity of the enzyme that helps to break those down. And so that's where testosterone can have a more protective effect long-term in both women and men when it comes to cognitive performance, decreasing the risk for dementia and Alzheimer's, again, at optimal levels, at physiologic levels, not at supraphysiologic levels.
Awesome. Thanks for taking us through that. I think I shared this with you when we were actually out of the office. I had a patient reach out, 80s, a little bit of mid-80s.
Somewhere.
I don't want to misrepresent that. She had an increase in bone density by 8.8% on her recent bone density scan, which was like so cool.
Yeah.
Right? Like, that's why we do what we do. So she's awesome.
Well, and when you look at risks, things like vertebral fractures and hip fractures in women in their 70s and 80s. There is huge morbidity that accompanies that in terms of changes in quality of life or becoming more sedentary and increasing risks for other significant diseases. So that's huge.
Yeah. All right. So the finale for this episode, we're going to talk about how HRT is not FDA approved. Again, this is changing, right? There's some like testosterone injections are improved for men. This is changing, but there's kind of this overall message that gets sent out from providers at times who aren't familiar with the hormone world that hormone therapy is not safe. It's not FDA approved. Or sometimes that bioidentical hormones are not FDA approved because they come from a compounding pharmacy. So I just want to share with you guys a few little stats here around FDA approval. Okay. So in 2014, prescription drugs had a 1 in 5 chance of causing serious reactions with FDA approval. Right? So 1 in 5 of these FDA approved medications had serious reactions or serious side effects. Around 1.9 million hospitalizations happen every single year because of prescribed FDA approved medications. 2.74 million serious adverse drug reactions happen every single year. There are around 128,000 people who die from drug reactions that have been prescribed from them that are FDA approved. And I think that a lot of times these things can be underreported because we tend to see that where the reporting system isn't very great for how do we report, adverse drug reactions. So keep that in mind as well. It's actually the 4th leading cause of death. And the other thing, so all of those things to me are mind blowing, right? Like we have this, we need to have FDA approval, but what does that get us? How much help is that actually? And so there's this big, I think, debate also about compounding pharmacies versus our kind of regular general pharmacies like the Walgreens or CVS. And interesting to understand that compounding pharmacies have been around since 130 to 200 AD. Okay.
Wow.
And pharma, like our main pharmacies, were established in the 19th century. So again, compounding isn't new. Like creating these substances, especially bioidentical, to help the body thrive and function better on its own, this isn't a new thing, right? There's much more history and time that has proven those things to work well. Again, when you're using the right ones and you're being smart about how you're going about that. So kind of takeaway here, this whole idea behind, well, it's not FDA approved. I threw out some stats there for you guys about FDA approved medications. And when we just simply break this down, right, these FDA approved medications, these, big pharma who have created these medications, they are developed and created to change or block or change something in the way the body is working to create the desired outcome, right? So blood pressure medications, they are created to, like calcium channel blockers, right? They're blocking something that the body is doing to create the desired outcome of lowering blood pressure, right? So these FDA approved medications are made to change the way the body is working, okay? And these are approved and these are supported by a lot of our medical community, but it's not as well supported to put back in the things that are naturally supposed to be there, specifically these hormones, right? Our sex hormones, our testosterone, our estrogen, our progesterone. And that's really, I think, where the rubber meets the road for me is I personally would much rather use a compounded bioidentical hormone to put back in to create all those things that my body is supposed to do naturally with the natural substance that is supposed to be there, but it's not there, versus getting these blood pressure medications because now I have high blood pressure, or taking these osteoporosis medications that hopefully just slow down bone loss and don't actually rebuild bone. Why are we not putting the things back in that God created to be there and actually rebuilding and reestablishing that healthy body overall. That's really where I think our hearts are, is God created us perfectly. And how can we help reestablish that and put back in the body what's supposed to be there? I don't care if it's FDA approved or not. If God created me that way, it needs to be there. It has a purpose.
Yeah. And it's interesting how medicine in this country has moved toward big pharma as the first response. Well, a person with high blood pressure, write them a prescription right away. Whereas what we're finding is that is a great methodology to keep people sick and keep them in a bad lifestyle, or because you're not addressing that. You're just putting a Band-Aid over a symptom or making a blood pressure reading look better or a lab result look better. But is that person actually getting healthy? And is it supporting longevity? And the answer is no. That's the effect of big pharma. And there's a lot of history to support that in our country too.
For sure.
What we're trying to do is change the script on that and saying, let's instead use pieces to instill a healthy lifestyle, not only for short term, but also for long term to affect 10 years from now.
Yeah. So overall takeaway, I think hormones not only impact quality of life, but they also impact longevity. And that's kind of what this whole month is about, is healthy aging. How does that happen? And so hopefully there were some key takeaways for you guys to kind of have an idea of how do I age better and more healthily. That word?
It is today.
All right. Any closing things from you for these guys?
I would say the only closing thought I have is really take a look at your lifestyle and take a look at the things that are going well. If there are things that are not going well, find a provider, whether it's here with us, whether it's at another clinic who is going to take a lot of time with you. Listen and really care for you in a way that is beyond just a patient-provider relationship, but care for you as a person. I mean, that's the thing. And, I sound like a broken record on this, but healthcare has to transition back to people just taking care of other people.
Yeah.
Not this, I'm the expert and you need to listen to what I say, but wholeheartedly listening to a person and then finding a way to move forward in the right way.
Love it. All right. So next month, October, is Breast Cancer Awareness Month. So we will be recording an episode specifically around that. We have had the opportunity and the pleasure of working with several breast cancer survivors. So we'll bring you all the good information there. All right. See you later, guys. Thanks for listening in to the Flourishing Life podcast. You can watch this full video version of this podcast inside the Spotify app or on our YouTube channel. If you like this episode, please rate, review, and subscribe on your favorite podcast app. And be sure to share this episode with a friend. And follow us on socials at Flourish Medical Wellness and on our website at flourishmedicalwellness.com. The information on this podcast is for educational purposes only and is not intended to replace medical advice or to be a substitute for professional medical diagnosis or treatment.